Good morning, my name is Dorian and I'm a registered nurse. This month's lesson is going to be about bloodborne pathogens. So, just so you know, after this lesson you will be required to take a 10-point quiz. Okay, we're going to get started with why is it important to protect yourself from contact with blood and body fluids. Though they cannot be seen, there are hundreds of tiny organisms living inside of our blood, and these can cause diseases in humans, and they're called bloodborne pathogens. Some of these organisms can be harmless and can be handled easily by the body immune system, but others can cause severe illness such as hepatitis or AIDS, HIV. Standard precautions are what we use to fight back against bloodborne pathogens and to protect ourselves while we're providing care. Some examples of what a bloodborne pathogen is and how it can be transferred are blood, semen, vaginal secretions, saliva, synovial fluid, pleural fluid, pericardial fluid, feces, and nasal secretions from the common cold. The more common ones are sputum or spit, sweat, tears, urine, and vomit. Treat all bloodborne pathogens and body fluids like they are infections. The most important thing to remember is always protect yourself. Number one, the most important way to fight back against disease and infection is hand washing. I repeat, hand washing is the most important to protect yourself while you are working. Hand washing is the single most important thing that you can do to prevent the spread of an infection. Thorough hand washing removes the pathogens from your skin. Wash hands before and after all body fluid contact. I repeat, please wash hands before and after all body fluid contact. When you are wearing gloves, as soon as you remove your gloves, you need to wash your hands. Wearing gloves protects you, but the hand washing is the most important to make sure you don't spread the infection. The proper hand washing procedure should take you about 35 seconds or about as long as it takes you to sing the alphabet. If you are not washing for long enough, your hand washing will be less effective. So, I'm going to go through the steps with you just because it's that important. Step 1. Remove your watch or push it up your arm. You should not wear rings or bracelets while you are working for this reason. 1, because they can harbor germs up under the jewelry. Number 2, do not touch the sink with your hands while you are washing and stand back from the sink to keep it from touching your clothes because the germs can live on the surface for a couple of weeks. So if you're touching the sink, you can be reinfecting yourself. Use warm water. Hot water may dry out the skin and cause it to break. Either use bar soap or liquid soap. If using a bar soap, rinse it first and hold it the whole time you are lathering. Soap does not have to be antiseptic unless you are doing an invasive procedure such as catheterization. Wet your wrists and your hands. Apply plenty of soap. Work up a thick lather all over the hands and the wrists between your thumbs and fingers. Make sure you scrub for about 35 seconds, singing the alphabet. 60 seconds is better. Friction helps remove the dirt, and always do up under the nails. When you are done, rinse with warm water, letting the water run down. Do not let the water run back up because you can, again, reinfect yourself. Always dry with a clean paper towel. Turn off the faucet with the paper towel. Do not use your bare hand or you have to start all over again. Okay. When hand washing facilities aren't available, you can use an agency-approved antiseptic hand cleaner or antiseptic towelette as soon as possible. And please wash your hands as soon as you can, even after using an antiseptic wipe. Number 2, we're going to go with gloves. Now that your hands are all clean, it's time for us to go on to put on our gloves. You should use gloves in any situation where you think that there is a possibility for you to come in contact with blood or body fluids. Gloves are for patient care involving contact with the mucous membranes such as brushing teeth, and changing gloves and washing hands between patient contacts is very important. Use gloves when you have scrapes, scratches, or chipped skins on your hands. And do not wash or disinfect your gloves or try to reuse them. Never, in any situation. Number 3, we're going to talk about protective barriers. A protective barrier, including gloves, reduce the risk for your skin or mucous membranes to be exposed potentially to infected body and blood fluids. You should wear the appropriate barriers while you are working. Your employer must provide suitable personal PPE or personal protective equipment in all sizes. Eye protection is for your eyes. This should be used in any situation that splashing will be possible, such as suction in the trach, blowing of the nose, anything of that nature. All PPE has a certain disposal place. You need to know this because if you dispose of it in the wrong place, you can cause another person to be infected. A sharp, such as any needle, is any object that can penetrate the skin, such as a needle, a scalpel, broken glass, tubes, wires, anything sharp that can break the skin. These must go directly into the sharps container and follow the agency's policy. Be careful to prevent injuries from needle sticks and other instruments after procedures. When cleaning instruments and disposing the used needles, do not recap or manipulate needles. This may be a test question, so please never recap a needle. It's best to use needleless needles when you have to do an injection. If you must use a regular needle, please remember, do not recap the needle. If it's absolutely necessary to recap the needle, use one hand to slide the needle into a cap laying on a flat surface. Do not hold the cap in your hand while recapping. So, now that we know what bloodborne pathogens are and how they are transmitted and spread, we need to know what happens if you come in contact with a bloodborne pathogen. Immediately following exposure to blood or body fluids, wash the needle stick, the cut, with soap and water. Wash splashes to the nose, mouth, or skin with water, or irrigate the eyes with clean water, saline, or sterile irrigation. You need to report the incident at once. This is not something that you should ever hide from a superior or a manager. You need to let them know right away. Treatment may be recommended and should be started as soon as possible. You need to see a medical professional. Discuss the possible risks and the need for treatment with the person if it's not you that was exposed. Remember that mandatory testing of a patient is not legal. You do have the right to refuse to have your labs drawn after a needle stick, but that's not recommended. Patients who might be the source of an infection must give the consent to be tested. So what that's saying is if you got the patient's blood on you and now you want them to be tested for HIV, they have the right to tell you no. Just FYI. So, with you being a worker, you do have some rights. The Occupational Safety and Health Administration is a federal agency that guarantees rights to a safe workplace. Under OSHA's rules, workers who might be exposed to contaminated blood or body fluids have specific rights. Employers must train workers that might be exposed to blood or body fluids about the hazards and how to protect themselves. This training must occur during work hours at no cost to employees or orientation and annually thereafter. So this is what we're going over now. Standard precautions must be practiced at all times. I repeat, standard precautions must be practiced at all times. Puncture-proof and leak-proof containers must be provided for disposable sharp items. There must be a system for reporting exposures to blood or body fluids. The worker responsibility. That means you always use standard precautions. Again, actively participate in evaluating safer equipment and encouraging your organization to purchase safer equipment. Be open to using new products or practices that could prevent exposure in workers' patients. Be immunized against hepatitis B. Getting a series of the 3 injections has proven to be very effective for people in the medical field. Report all exposures immediately after cleaning and disinfecting the exposed skin or mucous membranes. Comply with post-exposure recommendations for your organization. So, sum it all up for you. If you get exposed, wash it right away. The minute you're done washing, tell the supervisor right away. Not following these policies could result in some type of disciplinary action against you, believe it or not. So this is very important. So, as you know, HIV is a thing, and we have to protect ourselves against it. HIV is a virus that causes AIDS. The risk for infection after exposure is possible. A needle stick is the most common cause of work-related infection. Risk factors include the amount of blood or fluid, the puncture depth of the needle, and the stage of the infected person. The average risk of HIV infection after a needle stick or cut exposure is 1 in 300. Although that's not a lot, it's still possible, so you should protect yourself at all times. The risk after exposure of the eye, nose, skin, or mouth to positive blood is less than 1 in 1,000. If the skin is damaged, the risk may be higher. Treatment after exposure. There is no vaccine against HIV. Post-exposure treatment is not always recommended. A physician or exposure expert should advise you. Drugs to prevent infection may have serious side effects. Perform HIV antibody testing for at least 6 months after exposure. 99.7% of needle sticks cut exposures do not result in HIV. Hepatitis B. Everyone with a chance of exposure to blood or body fluids should receive the hepatitis B vaccine, preferably during training unless it's contraindicated because of your allergies, pregnancy, or potential pregnancy. Risk of infection after exposure. Hepatitis B vaccines prevent this disease. I repeat, hepatitis B vaccines prevents this disease. Persons who have received the vaccine and develop immunity are virtually no risk for infection. A series of 3 injections are required, given initially, then 1 and 2 months later, and then 4 to 6 months later after the first injection. Workers should be tested 1 to 2 months after the vaccination series to make sure that the vaccination provided them with immunity. So as we discuss bloodborne pathogens, you must know the different types of infection. We have contact precautions that we use, as well as droplet and airborne. Contact germs are germs that can cause the spread of disease by touch. Examples of diseases caused by contact germs are the pink eye, scabies, wound infections, MRSA. To prevent from contact precautions from contact germs from infecting you, you should always wear gloves, treat bed linens and clothes and wound dressings as if they are infected. Wear a gown if the patient has drainage, has diarrhea, or is incontinent. Use a disinfectant to clean the stethoscopes, blood pressure cuffs, or other equipment. So contact means by touching. When they say what precautions are we using, if it's contact, that means there's things in the room that you should definitely not touch with your bare hands. Moving on, we're going to go into droplet, as for example, when you sneeze, the stuff that comes out of your nose, that would be considered droplet. Droplet germs can travel short distances through the air, usually not more than 3 feet. Sneezing, coughing, and talking can spread these germs. Examples of diseases caused by the droplet germs are flu and pneumonia, which are 2 very important diseases that you should know how to fight against. Precautions include the following. Always wear a mask when working close to the patient within 3 feet. If you are transporting a flu patient somewhere, then that patient needs to wear his mask as well as you. Now, I have a case study here, and it's going to help you get more familiar with droplet and contact precautions. So we're going to discuss that. All right, so Tammy is a home health aide assigned to provide personal care for John Adams. John is a 70-year-old married male who recently was discharged from the hospital where he had been treated for an infected wound. The infection grew out of MRSA, an infection, and is still draining. Mary Adams, his wife, is very anxious for her husband to fully recover so they can resume their activities with their friends. John has covered the wound on his abdomen with the RN that comes in daily to redress it. There is drainage, but only a little shows through as bloody on the bandage. When Tammy attempts to provide personal help with bathing and dressing John, Mary always insists that Tammy does not wear gloves or protect her clothes with a gown since the drainage is so little. Tammy does not wish to upset Mary, so she does not wear gloves or a gown, and she is very careful to wash his abdomen without getting near the dressing. Think about it. What is Tammy doing wrong, and what should she be doing in this situation? So, first and foremost, what should Tammy be doing differently? Tammy should be educating the patient and the family member the importance of hand washing and using PPE. There will be many times that the patient is going to want you to do something that is not safe for you, and you have to be strong enough to tell them that you cannot do that. If it's something that's going to put you in harm's way, then you do have the right to tell them no and to follow the policy. I say this because you can be nice and do it without gloves, but then if you get infected, it's pretty much going to be down to you did not follow the standard precautions, and you never want to be on the side of that. Number 2, is it okay that she ignored the standard precautions since the wound was draining so little and only a little shows through the bandage? Absolutely not. Even though there was a little drainage, it's still enough to infect a person. And sometimes all germs aren't visible. Just because it was only a little, that does not mean that they were not there. That's a no-no. Never do that. Number 3, what more could Tammy have taught Mary about the proper care of John? I repeat, she should have taught Mary that hand washing and PPE is the single most important technique to use to prevent the spread of infection, and also that not washing hands could further worsen the infection and prolong John's recovery. Number 4, is this infection contagious? Yes, absolutely. MRSA is very contagious as well as the flu. All right. What should she do with his linens? She should wash them in soap and water. She should make sure that she holds them away from her clothing when transporting them to wash them, and also protect herself while she is holding them with gloves or a gown or whatever necessary to keep herself safe. All right, now it's time for the test.